There are various different kinds of strains of probiotics, okay? There are bacterial strains, there are friendly yeast strains, okay? And there's also what's called a humic strain, which comes from like soil bacteria that actually we used to have as part of our daily diets. When we ate vegetables right out of the garden, okay, we really didn't wash them that much, and also the soil wasn't toxic as much as it has and depleted. So there's a company there's several companies that make humic ones. One of the best companies that have a product that is a humic probiotic is Research Nutritionals, okay? That's why I invited Caleb Bartz here from Research Nutritionals to come with some of his samples. The product that they have here called Prescript-Assist Pro does not have to be refrigerated, okay? It's stable at room temperature for quite some time. Now you have to keep in mind that the different strains of friendly organisms in your gut, from bacterial to yeast to the humic strains, okay, all have different kinds of activities. Now, the interesting thing you got to remember is that these strains, okay, do not colonize the gut. If they did, you'd have problems. They act as a Band-Aid, a living Band-Aid on your gut to allow your own friendly, naturally, genetically in tune with your body, probiotic organisms to regrow, regroup themselves, and to help with your immune system, okay, in the bowel, help to fight candida, help to break down what's called biofilm. Now, that's a concept that you may not be familiar with. My patients who are in this room, would you please raise your hand? Okay. Have I not talked about biofilm with you? Yes. Okay. Biofilm is a very interesting concept, which is more than a concept. It's actually an entity. Okay. Biofilm has been researched over the past 15 years. This is a mucopolysaccharide substance that these pathogenic organisms like yeast and Clostridia actually secrete around themselves. It's like a shield against the immune system and against antifungal medications. So that's one of the resistance issues that we find, that when we give people antibiotics or antifungals, that they may not get completely better because the candida hide within this biofilm matrix, parasites hide within this biofilm matrix, viruses hide within this biofilm matrix, and they all kind of like live happily ever after. And the only way oftentimes to get at these organisms is to use a substance that is specifically geared to break apart this biofilm. And there are biologic substances like herbs, okay, that we know will break it apart. We know that there are certain enzymes, peptidases, okay, that will break it apart. And there's a substance that is used in chelation therapy called EDTA, which helps to pull out heavy metals, will actually also help to break apart not only the biofilm, but also helps to weaken the cell membrane of these organisms like yeast and bacteria that can actually allow them to be killed a lot more effectively. So your question is very apropos, because I have found in my practice over the past, I would say 20 plus years, that there are a number of patients, anywhere between 75 to 85% of my patient population that comes in with things from asthma, diabetes, high cholesterol, eczema, psoriasis, mental brain fog, etc., depression, anxiety. Many people have an overgrowth of yeast and candida, and many also have Clostridia difficile. And when I start to get rid of the candida, I am able to more effectively treat and help balance things like hormones, nutritional deficiencies, because these bugs actually live off of those nutrients that you take in. So when you take vitamin B12 or B6 or B2, these bugs are sitting there going, thank you, give me more Seymour, feed me Seymour, okay? They also live off of magnesium and iron, okay? My suspicion, a lot of women who come to my practice that have a chronic anemia and they're not, and even though they may be menstruating or they may not be menstruating, okay, oftentimes they have candida. And that by getting rid of the candida, their anemia also gets better treated and resolves, because these bugs are living off of the iron, okay? So the different species of probiotic organisms, okay, are used depending upon what you're trying to do. It's a tool, just like when you go to the hardware store and you pick up a hammer or a saw or a chisel or whatever, you're looking for a particular tool to use for a particular job. And when it comes to, is one brand better than another brand, it's like any other tool. Is one hammer from one company any better than another hammer? Well, what's the hammer that you're using? Okay? How big is it? Okay? Does it have a claw, okay, on it? Will you be able to take nails out? What's the utility of it? So as an integrative practitioner of 20 plus years, okay, I can tell you that the tools have to reflect what the task is at hand. What we have found is that when there's a disruption, okay, in the gut, okay, about 40 to 60% of your bowel's function is to make brain serotonin, okay, and dopamine. Yes, yes, your gut is very important for the health of your mind, okay? And if your gut is not working functionally well, okay, you will have an imbalance in neurotransmitters, which affect mood, concentration, focus, all those things, okay?